Hi, my name is Jornay Rodriguez, and I'm here to persuade you into thinking about the doctors and nurses and their bedside manners. My question to you is, should doctors and nurses be retrained in bedside manners? There's a thing of bedside manners that really progresses over time. The care of the individual and the dynamics of their situation in health and mental, physical, and emotional. So there's a question: is it possible to retrain based on those elderly who are terminally ill? It should be. And the reason why this is that the elderly is always being held to a last form of standard. So you can have an elderly person on death's door with cancer right now, and they will be treated worse than the ones who are younger than them. And this is the reason why. People that are younger are more susceptible to surviving a cancer scare or a serious cancer within itself because they have youth on their side and they can bounce back from it. However, the elderly are not so fortunate. It takes them longer to heal, longer to process, longer to create antibodies and things like that to survive it. Now, it's harder on an older person who is terminal. All they want to do is be healed, but there's no use to that. However, what do you do in that position as a physician, as a bedside person who is going to say, hey, look, this is what we're going to do for you? So I believe that they should be retrained based on the fact that of what I've seen from past experiences of individuals who have been terminally and never gotten a due space for themselves in order to heal or be in comfort to pass. So this is the thing. I found it most important that you look to the value of the individual as a person. Now, doctors and nurses are trained and taught to partial bedside manners, be nice and kind and courteous and empathize into what is needed for the patient. However, they're very aggressive in what they do. Some are not emotionally attached to anything, so they separate it. So you might get a doctor that says, well, you need to get this cut out of you. And that's what's going to happen. Well, without you actually telling them, hey, I don't want that to happen. Now, they're going to persuade you to continue to go through a surgery or some sort of non invasive practice or routine in order to get that done. However, that's going to make you uncomfortable. Now, it may help for your survival rate. However, it may not. It's a gamble. Now, to the elderly, that is a risk that they are willing to take. However, they know the reward is on the back end because the risk is greater than the reward in itself because they know they're more susceptible to dying in this practice than not. So doctors don't give them the notion of comfort in any of that. And if they're terminal, at that point, they're not going to do anything. They're not even going to try to help you survive. So what they're going to do is dope you up full of pills, get you going to rest bed, and get you going out of the way. And that is a tragedy. It's a tragedy in itself. The life that you live needs to be focused and conquered, and you need to do it in your own way. If you have 2 weeks to live, what do you want a person to tell you? Oh, I'm going to try to operate on you so that you can live a few years longer. Wait, that's not true in the case, because that is not going to help the situation at all, because you know it's terminal and most likely you're going to die from it anyway. So instead of protecting them, be courteous to what is there. I had a buddy that was terminal on liver cancer. He had cirrhosis of the liver. He was terminal. And what they did to him was they passed the buck on him. They sent him to multiple doctors over time, saying that, oh, we can help you, knowing that it's a terminal issue. And instead of telling him with the first doctor, they kept passing the buck with him to multiple doctors. And so the final doctor that really had compassion for him said, this cannot be saved. You cannot be saved based on the fact that this is so bad. Your liver is so damaged to the point that you will need another liver to survive. And in the end, the doctor prescribed him medication and doped him up to the point where he was incoherent in anything. And that was a problem, because you don't have any more life to live after that. So in order to cloud your frame of thinking is wrong. You should be able to see your way through life as best as you can, and not be put into a position where they're going to dope you up and not treat you as good as you should. Because anybody else in that same similar situation will be flown out to a private hospital, given many chances of donor livers, kidneys, and all that stuff in order for them to survive it. And then they will treat them like they are individuals who are going to live, not individuals that are going to die. And that is the difference between bedside manner and individualized manner. So the practice is for professionalism to be more accepting of bedside manner as to individual personal matters, based on how do you feel, what do you want to do about your life at the end of it, because it matters, because living life matters to you and to nobody else. Thank you. Have a good day.